look at this case. A 48-year-old man with familial hypercholesterolemia is already receiving maximally tolerated atorvastatin therapy, but his LDL cholesterol remains markedly elevated. The physician decides to add a drug that increases the number of LDL receptors on the hepatocytes by inhibiting the degradation of LDL receptors. Which drug is most appropriate? The options are A. Ezetimibe, B. Evolocumab, C. Fenofibrate, D. Niacin. Guess the correct answer. The correct answer is B. Evolocumab. Why evolocumab is correct? Evolocumab is a PCSK9 inhibitor, a monoclonal antibody. Let's understand what happens to LDL cholesterol without evolocumab and with evolocumab. PCSK9 is produced by hepatocyte, it binds to LDL receptor and the complex is internalized and is directed to lysosome for degradation. So this causes fewer LDL receptors on the cell surface, resulting in decreased clearance of LDL from blood and high LDL cholesterol in blood. So to be noted that PCSK9 is responsible for decreased clearance of LDL. Now, when evolocumab is administered, it binds to PCSK9 and so PCSK9 can no longer bind to LDL receptor. So the LDL receptor remains unbound and is internalized and is recycled back to cell surface. So this causes more number of LDL receptors on the cell surface and increasing the clearance of LDL from blood. So this results in low LDL cholesterol in blood. So evolocumab results in lowering the LDL cholesterol. What about option A, ezetimibe? Ezetimibe blocks intestinal cholesterol absorption by inhibiting a transporter, that is NPC1L1 transporter. So this causes lowering of cholesterol levels. Fenofibrate primarily lowers triglycerides by activating PPAR alpha and is mainly used in hypertriglyceridemia rather than severe LDL elevation. Niacin can modestly improve lipid profile but is less preferred because of adverse effects such as flushing and limited cardiovascular outcome benefits. So the most appropriate option is evolocumab.